各位好，我是爱视眼科中心的陈卓医师。爱视眼科中心旨在用最新的医疗设备、最先进的医疗技术，给大家提供最佳的医疗服务。近视眼是亚洲人最常见的眼部疾患。近年来，由于电子产品的运用以亚洲人群的增多，在美国近视眼的发病率也增加了30%。下面我就给大家介绍一种新型的治疗近视眼的技术——角膜塑性技术。
My name is Dr. Kerry M. Herzberg, and I am the founder and president of the Orthokeratology Academy of America. I would like to personally welcome you to this OAA video. The Orthokeratology Academy of America's board of directors and members are made up of eye care professionals dedicated to learning and mastering the art and science of orthokeratology. The Academy's mission is dedicated to educating our colleagues and the public about corneal reshaping. The fact that you are watching this video is a great step in accomplishing that mission. Orthokeratology was first used to correct nearsightedness over 40 years ago. While the procedure has benefited from the latest technological breakthroughs over the years, it has accumulated many different names to describe the same procedure. Orthokeratology is also known as Ortho-K, corneal refractive therapy or CRT, vision shaping technology or VST, accelerated orthokeratology or AOK, gentle vision shaping system or GVSSS, gentle molding, and finally overnight corneal reshaping or OCR. These procedures may differ slightly in technique, but all fall under the orthokeratology umbrella. So when you hear the many names of orthokeratology, don't let them confuse you. They are all referring to the reshaping of the cornea with a therapeutic contact lens worn only overnight, so you may see all day long without wearing glasses or contact lenses.
A far-sighted, nearsighted, or astigmatic eye is one where the images are focused inadequately on the retina, which results in blurred vision. Orthokeratology treatment involves wearing a unique, specially designed contact lens while you sleep, which reshapes the front surface of the eye and improves your vision. To get the general idea, think of it as braces for your eyes. Here's how it works. The back surface of this lens is designed to create a specific shape and thickness of tear layer between the lens and the cornea. Overnight, the tear layer produces a hydraulic force between the lens and cornea, which molds it into the desired shape. This refocuses light on your retina where it belongs. You simply place these orthokeratology lenses on your eyes when you go to bed, and they gently and painlessly reshape your eyes overnight. After waking in the morning, you remove the lenses and enjoy crisp, clear vision all day long without glasses or contact lenses. It takes approximately 1 to 2 weeks for the treatment to reach its full effect. However, most patients notice a dramatic improvement in their vision overnight. It is not uncommon to be free of correction in just a few nights of wear, and for some of you, after only one night.
Hello, my name is Dr. Monica Allison. After learning about Ortho-K, you most likely want to know if you're a good candidate. The best candidates are people with mild to moderate nearsightedness and little to no astigmatism. However, depending on the shape of your eye, your doctor may be able to perform Ortho-K even if your prescription is outside the normal range. There are no age restrictions for Ortho-K. There are options for you if you wear bifocals, progressive lenses, and/or use monovision. It is a great alternative for kids. However, those with severe eye disease such as corneal dystrophies or degenerations, Sjogren's syndrome, or those with severe medical conditions are not good candidates. Let's talk about some special groups of people who would gain particular benefits. If your job requires or would be optimized by excellent vision without the use of corrective lenses, Ortho-K is absolutely the best alternative for you. Ortho-K is perfect for pilots, law enforcement officers, military personnel, and lifeguards. Are you an athlete or a weekend warrior? Imagine hiking, playing sports, swimming, skiing, or camping, even off-road driving, biking, snorkeling, and scuba diving without glasses or contacts. Now that's real freedom. Do you have small children? Ortho-K can give you a huge level of security in an emergency. There's no fumbling around for your glasses. You won't have to worry about being able to see as you rush to ward off disaster or many small occurrences that are inevitable for parents. For the rest of us, Ortho-K is just a great alternative to glasses, providing freedom, spontaneity, and confidence.
Tired of daytime contact lenses or glasses taking you out of the game? When LASIK isn't an option for you, Ortho-K lenses will give you back your competitive edge. Wear them while you sleep, and in the morning, well, you'll see.
Orthokeratology has several clear advantages over LASIK. Since it is such a safe and non-invasive procedure, the FDA has approved orthokeratology without any age restrictions at all. Children as young as age 5 can be fitted with Ortho-K lenses. LASIK cannot be performed on children, and in fact the FDA has said that it is not safe to perform LASIK on anyone under the age of 18. Orthokeratology is fully adjustable and 100% reversible. Should your prescription ever need to be updated, it's simply a matter of ordering a new lens with the proper prescription. Any adjustments with LASIK require additional surgery and increase the risk of complications. If for any reason you decide to discontinue orthokeratology, you simply stop wearing your lenses and your eyes will return to your original prescription. LASIK can never be reversed. Patients who suffer from mild to moderate dry eye and cannot tolerate daytime contact lenses may be excellent candidates for orthokeratology. LASIK actually causes dry eye and will only make an existing dry eye condition worse. Many people who are interested in LASIK cannot qualify for this surgery because their corneas are too thin. These people are excellent candidates for Ortho-K because it doesn't require a specific corneal thickness.
Contact lenses bringing your game down? Corneal reshaping lenses will gently reshape your eyes while you sleep. Let yourself enjoy everyday activities, have pain-free days at the office, no daytime contact lenses, no surgery, just great vision.
Orthokeratology is an excellent option for patients who have been unable to wear contact lenses during the day. These patients stop wearing lenses for a variety of reasons, such as discomfort, dry eyes, allergies, or what we simply call lens awareness. That feeling of the lens moving around and being uncomfortable. Many patients just resign themselves to wearing glasses, but there is an alternative they need to pursue, and that is orthokeratology. With this technology, the majority of patients who were previously unsuccessful wearing contacts can now be victorious. Ortho-K virtually eliminates daytime discomfort and fluctuating vision because the lenses aren't worn during the day. They're worn while they're sleeping, eliminating issues of discomfort, loss, and inconvenience.
The percentage of people with myopia, also called short-sighted or nearsightedness, is increasing all over the world. In some countries, such as Taiwan, over 85% of the 18-year-old females are myopic. In the United States, the percentage of people with myopia has increased nearly 70% in the last 30 years. It is a problem that is becoming worse at an alarming rate. Children are becoming myopic at younger and younger ages, and since myopia typically progresses as a child ages, this means we can expect a generation plagued by increasingly diminished vision and heavy, thick lenses. In summary, myopia is getting worse, and it is happening so rapidly that some have called it the myopic epidemic.
Children are particularly excellent Ortho-K candidates for a number of reasons. The most common reason children wear glasses is because of nearsightedness, also called myopia. Myopia typically progresses, gets worse over time, requiring thicker and thicker lenses. This occurs because the retina stretches and gets longer. This creates two problems: heavy, uncomfortable lenses, but even more importantly, risk to the retina. This lengthening of the retina is a risk factor for a detached retina or even glaucoma for your child as he gets or she gets older. If you could reduce these risks for your child with a simple, non-invasive process, I'm sure you would want to learn more. This creeping myopia can be controlled with a specially designed Ortho-K lens. This lens is something like braces for the eye, correcting the shape and even acting like a brake to stop this myopic creep. Here's how it works. Measurements are taken and a custom lens is designed for your child's eye. Your child puts the lenses in at bedtime, takes them out in the morning, disinfects and stores them safely at home, and then he or she goes about a normal day, school, sports, play, with great vision and no glasses all day. No lost glasses or prescription sports eyewear to worry about, and one less thing to provoke a bully's attention. Now you might say, my child could never do this. You'd be surprised. Kids are my best patients because they're so motivated to get rid of their glasses. Many Ortho-K patients are 5 and 6 years old, doing great and taking care of the lenses on their own. To benefit you, aside from providing the best eye care for your child, is fewer replacements from the inevitable loss and breakage that occurs as your child goes about an active life of roughhousing and play, No broken or lost glasses, no hassle with contact lenses during the day. One less opportunity for your child to get in trouble because they aren't wearing glasses at all.
If I take them out about 6 o'clock in the morning, until about 11:30 at night, I've got crystal clear vision. That's when I pop them in and jump back in bed. And any of the sports I want to do, fishing, hunting, if I want to go swimming, jet skiing, water skiing, anything of that nature, not have to worry about my eyes, not have to worry about losing a lens, glasses getting dirty, eyes drying out, anything of that nature. You just get up and you go.
For years I prescribed glasses for children. That's what I do as an optometrist. When parents would ask me why their children's eyes were worsening, I calmly tell them that it was genetic or hereditary, as I was taught many years ago. It was really something they couldn't control. However, when my own children's eyesight began to deteriorate, this dilemma took on a different meaning. Even though my wife and I started to wear glasses in college, both my sons started to wear glasses in 2nd grade. Fitting my children with orthokeratology lenses was not a decision I took lightly. Both my children were very young as 7 years old, and to be honest, I was concerned about their ability to take care of their lenses at such a young age. However, within a few weeks, they were able to take care of the lenses independently, and I've heard this from other patients. Although we had concerns, now, several years later, we know this was the best decision for my children. In fact, their eyesight has not experienced deterioration even through the 12 years that they've worn them. They're currently in college and their eyesight hasn't changed. And for that, I'm happy I did it.
I'm Kevin Reeder, an optometrist with over 400 patients from 5 to 63 years old, successfully wearing orthokeratology overnight lenses and seeing clearly all day without glasses or daytime contact lenses. Corneal reshaping therapy is a very safe procedure. However, as with any contact lens that is placed on the eye, there is a small risk, most typically a minor infection easily addressed by using antibiotic drops. This risk is the same as wearing overnight soft contact lenses and can be greatly minimized by adopting a regime of very careful cleaning and disinfecting, by wearing the lenses as prescribed by your doctor, and by maintaining the necessary progress visits. When this process is taken seriously, risk will be significantly reduced. I was an FDA clinical investigator for the initial clinical trials of the overnight corneal reshaping lens in 2000. After 2 years of careful monitoring of over 300 patients, this treatment for non-surgical vision correction was approved by the FDA in 2002 and was found to be very safe and effective for patients of all ages. This was the first of many studies that demonstrated patients could safely wear overnight corneal reshaping lenses to improve their vision without any serious side effects. Patient safety and continued eye health are always our first priority. You too can enjoy the freedom of clear, comfortable vision without glasses, without daytime contacts, and without surgery.
相信大家对角膜塑性镜已经有一个初步的了解。如果想进一步了解角膜塑性镜的应用，请与爱视眼科中心直接联系。谢谢。